We have with us Dr. A. Velumani, the MD at Thyrocare Technologies on the show right now. Dr. Velumani, good evening. Thanks so much for taking the time out and joining in. When vaccines were rolled out, and according to the government data, about 4 crore Indians have already been vaccinated. The surge in the cases, in the fresh cases of COVID, should actually be coming down. But this is actually moving the other way around, with a lot of states showing a big spike up, and it almost seems like we're back to square one, exactly where we were about a year back.
Vaccination will not bring the surge down for this small number. Your 4 crores is just slightly around 3% of your population. Remaining 97% of the population is still not vaccinated, number one. Post-vaccination, to get immunity, to get antibody, to get resistance, anywhere from 20 days to 50 days it will take. And a second booster dose also is important. So expecting vaccination to control the virus at this stage is a little higher expectation. But having said that, when the number of cases dead per day came down, it was not because we had won the virus. It is because we have an ability, which is the herd immunity. Vast number of population, Indians, much earlier than many of the Western counterparts, had higher antibody titers. And that probably brought down the number of people going to hospital and number of people dying. What was 1,200 in September had come down less than 100 just in the middle of January. So vaccination still is not controlling virus. Antibody is giving the protection. And according to me, it will take some more time. We need to improve the speed at which we vaccinate. This speed is going to take 1 year for the first round, and another second round will take another long period. So vaccination speed, according to me, is pathetically low.
Sure. But Dr. Velumani, is it a coincidence that the numbers in Maharashtra at the time of the first wave were also very high?
Yeah, it's a little confusing because the state Maharashtra behaving very different from either Delhi or Bengaluru or for that matter, other similar per capita income states. It's a worry. Mumbai alone means we can attribute a bit to the local train surge. But I think even the districts, different parts of Maharashtra also having alarming number rising. I am unable to truly scientifically reason out what could be the reason that Maharashtra tops the list far ahead of any other state. That's in fact a big worry. No scientific explanation can be offered.
Right. Dr. Velumani, we always use 2 parameters. One, of course, is being the number of deaths. Second, of course, being the viral load as well. You may be positive, but if the viral load is actually different in your body, your chances of being critically ill and being a carrier also actually reduces. What's been your experience currently in terms of testing as well as the access to lab reports?
Yeah, I was doing around 2,000 RT-PCR tests in the month of February. I thought it's now almost getting over. And that time, the number of positive cases were around 7-8%. But in this last 8 weeks, the 2,000 per day has now come to 6,500 per day. And what was 8% positive today is standing around 16 to 17% positive. Now, this increased positivity was there for RT-PCR, but then subsequently rapid antigen test brought down the numbers artificially low. And according to me, more testing is happening and more testing is happening in RT-PCR, and that gives rise to more numbers. But having said that, why Maharashtra has this high number is very difficult for me to explain unless there is some genomic studies done and some variants seem to be dominating in this part of the country.
Okay, so are there more asymptomatic cases which are now coming on board? Because earlier testing was done only after the prescription subscribed by the doctor and, you know, after examination of symptoms like cold, cough, etc. Now you can get yourself tested very, very easily. Is that the reason why there is a spike in the numbers also, you think?
No, the symptomatic, non-symptomatic in case of COVID was highly confusing from the day one. From April 2020, for the last 1 year, who to be tested, who need not be tested is a very big challenge because majority of the people who carried the virus had no symptoms, and the guys who had symptoms did not have RT-PCR for COVID positive. So this confusion remained. Even now it remains. According to me, post-vaccination, there are good number of people who are probably getting it tested, whether it with symptoms, with additional symptoms, without even with some doubt, I don't know. Then again, a coincidence. Vaccination happens in the beginning of February. From February onwards, the number of cases are going up. For me, scientifically, vaccination will increase the number of positive cases is not acceptable. Vaccination is not supposed to be doing that. That means then we are totally doing wrong. It will be a calamity if that can be right. So vaccination cannot give rise to more positive COVID PCR. More people are testing, more tested are positive. What is the reason in Mumbai or in Maharashtra for that needs to be very seriously studied.
Sure. Dr. Velumani, the reason why while we were able to come out of the first wave exactly the same time last year was stringent lockdown. The number in Mumbai is more than even the previous peak as of now. Do you think now is the time that we need to ask a very basic question as to why is it that we're not implementing a semi or a full lockdown?
For some reasons, I don't know, my science did not truly accept the word lockdown beyond 2 or 3 lockdowns. Lockdown was to reduce the overcrowding on beds and the overcrowding in hospitals. Very fairly, all right, April lockdown 2020, May lockdown 2020, June lockdown, I think that's done. Once the number of hospital beds are adequate, then we have removed the lockdown. And let me tell you, I've been telling for the last 1 year, virus will never become weak, tired, or die off. Virus has to be faced. If today, if I see there is a surge in number of cases, infected, positive, but there is no significant surge in the number of deaths per day, I believe this is the right fight to give, tolerate the number of positivities for some more time. There is a likelihood before the vaccine vaccinates, the virus vaccinates. I strongly believe from the day one virus has been vaccinating without discriminating young or old, it has been doing its job. So if you ask me, lockdown can reduce the number of positive cases, but then once again, when you remove the lockdown, you will have to face the music. Either face it, you should have faced it yesterday, or face it today, or you have to face it tomorrow. Lockdown is no escape. Lockdown is a delay of the exposure.
Okay. Dr. Velumani, one last question. And as we speak, there's been a government notification that for AstraZeneca vaccine, the time limit between the 2 dosages is going to be increased from the earlier 4 to 6 weeks to now 4 to 8 weeks. Scientific analysis, which is about 40 to 50 days of the vaccine, is working. And there is enough and more evidence which says that if you are vaccinated with the booster shot also, and after 15 days of that, your body is getting protected. What is your take on the same?
See, with all said and done, the thesis of vaccination, immunization for the last hundreds of years is it protects. Because it protects, you get rid of the virus faster. Because everybody gets rid of the virus faster, virus load in the environment becomes lesser. And in the long run, virus dies off. This is the premises on which vaccinations work. How fast? Because every virus is different in its virulence. Number of multiplications, replications it undergoes is very, very different virus to virus. So if you ask me, very difficult to predict the behaviors. Only we can tell the past performance of other viruses. No virus need to be exactly replicating the past performance. It's like stocks. Stocks and viruses are very, very different in their behaviors. So in my opinion, we will have to learn maybe by end of June, July, we will have some knowledge. But as of today, I will urge, in fact, I was a bit worried to hear health minister's statement yesterday, all need not be vaccinated. I think that's a bit of a concern. If at all, if you don't vaccinate everyone, you are going to not get rid of the virus at all. So I believe he had some credible support to make that statement. Virus is complicated science. No virologist alone is right, no immunologist alone is right, and no bureaucrat alone is right. It needs a huge body, sit and analyze and take a decision whom to vaccinate, how fast to vaccinate, and how late or how early we should give the booster dose. Let me tell you, everybody knows very little. Collectively, probably we will know a bit more than individual alone can take a call.